Welcome to Hotze Elite Physicians Podcast, where you'll learn how to help your patients obtain and maintain health and wellness naturally, and how you can have more time, more money, and more freedom to enjoy your life. And now your host, Dr. Hotze.
The greatest catalyst to growth at the Hotze Health and Wellness Center began in 1992 when we incorporated the evaluation and treatment of patients for hypothyroidism. I'm Dr. Steve Hotze, and I believe that you need a successful doctor to help you design and build a successful medical practice. Why? So you'll have more time, more money, and more freedom to enjoy your life while your patients experience natural approaches to obtaining health and wellness. In 1992, a friend of mine and mentor, Dr. Dick Mabry from Victoria, Texas, told me at one of the conferences that I was attending, Pan American Allergy Conference, he said, "Steve, you've got patients in your practice that have hypothyroidism." I said, "I do?" He said, "You do." Now, at that time in my practice, I strictly did airborne and food allergies. I treated for yeast, and I used vitamin and mineral supplementation. And now he was recommending that I evaluate our patients for hypothyroidism, not just on blood tests alone, but on their clinical symptomatology. So he said, not only should you evaluate them on their clinical symptomatology and give them a therapeutic trial of natural desiccated thyroid hormone. He recommended Armour Thyroid at that time, but you should also do blood tests to see if they have autoimmune thyroiditis. So you do that by checking for thyroid antibodies. So I thought to myself, that's interesting. So after listening to Dr. Mabry make these recommendations, I decided I would ask the head of our society, Dr. Dora Brown, who had a huge medical practice in Fredericksburg. People came from all over the world to get his treatment on allergies and his other treatments that he had. So I asked him, I said, "Dr. Brown, Dr. Mabry says I have a lot of patients with hypothyroidism in my practice." He said, "You do?" I said, "Well, should I treat them with Synthroid or Levothyroid, or should I?" He said, "Use Armour Thyroid." I said, "Armour Thyroid?" "Yes, use Armour Thyroid." I said, "Why?" He said, "It works." Oh, okay, that was it. That was his recommendation. He didn't mince words. So when I came back to my practice, I decided that I was going to begin to evaluate my patients who were doing well on their allergy treatment to see if they had these symptoms of hypothyroidism. And I purchased a book that Dr. Mabry recommended. And that book was entitled Hypothyroidism, the Unsuspected Illness. And it was written by Dr. Broda Barnes. I read that from cover to cover. I found it fascinating. So I began to devise a questionnaire that incorporated the symptoms of hypothyroidism to see how many of my guests had those symptoms. And those would be fatigue, difficulty with weight, low body temperatures, classical feature, inability to focus and think clearly. Women commonly call it brain fog. Mood swings, inability to sleep soundly, joint and muscle aches and pains, sluggish bowels or abnormal bowel function, recurrent and chronic infections. Women had menstrual irregularities. These were the symptoms that I evaluated in my history. And I found that many of these individuals had multiple symptoms like this. Now, we also drew blood, and we found that 31% of my allergy patient women and 18% of the men had antibodies to their thyroid gland. They had autoimmune thyroiditis, or Hashimoto's thyroiditis, as it's also known. And, of course, those antibodies adversely affect the thyroid gland. It attacks the thyroid gland, and it can cause improper function of the thyroid gland, and over time it causes fibrosis to develop and scarring, so the thyroid gland doesn't function well. In fact, some people, as they get older, without any treatment at all, without any thyroid, their thyroid gland will completely be eradicated by the scar tissue if they have severe autoimmune thyroiditis. So based upon the recommendations of Dr. Mabry and in reading the book of Dr. Broda Barnes, I began to start our guests who had the clinical symptoms of hypothyroidism on low doses of Armour Thyroid. And we had dramatic results. My goodness. They told me, I've been telling my doctor for years I had low thyroid. He wouldn't listen to me. He said, your blood tests are normal. Or I'd have patients coming in on synthetic thyroid and said, the doctor said I had hypothyroidism based on my blood test, and they gave me all these medications, the Synthroid or Levothyroid or Levoxyl. I don't feel normal. And he said, but your blood tests are normal. But I go, doctor, I don't feel normal. And he wants to put me on antidepressants and anti-anxiety medications and sleep medications because he says it can't be your thyroid if your blood tests are normal. Well, here's the deal. Most physicians are trained to treat strictly on blood tests. All that measures is the amount of thyroid hormone T4, measures T4, or the thyroid stimulating hormone, which is reading T4 in your blood. It tells you whether or not you got thyroid in your blood, thyroid hormone. It doesn't tell you if you have it in your cells and in the proper amount. That can only be determined by a clinical history and a body temperature. So I began to look at the body temperatures of our patients as they came in during the day, and we found that the average woman's temperature that we saw was 97.2. The average male's was 97.6. We had people down in the low 96s, even 95s. They're ice cold. Their hands are cold. Their feet are cold. They have cold sensitivities. Even in the summer, they want to wear a sweater. So that told me that they were not getting enough active thyroid hormone, which is T3. Remember, the synthetic thyroid hormone is T4. 4 iodine atoms hooked to the thyroid molecule. That's the inactive thyroid hormone. It has to enter the cell. There, the deiodinase enzyme cleaves off one of the iodine atoms, and you're left with T3. And the active thyroid hormone, which goes to the mitochondria and activates the mitochondria to produce energy. It's like the spark plug of the cells. If you don't have enough spark plugs in your car, you got an 8-cylinder car and you only have 7 spark plugs, it's going to run rough and sluggish. You're not going to produce the energy. You can't go as fast. That's the same thing. If we don't get enough active thyroid hormone into the mitochondria, then we have low energy production. We're low voltage individuals, and they have all the symptoms that I described earlier. The fatigue, which is a very most common complaint we have. Doctor, I just don't have any energy. I'm tired all the time. Difficulty with weight, cold body temperature, and also cold sensitivities, difficulty with thinking, difficulty with their moods, sleep, joint muscle laxity pain, sluggish bowels. They're sick all the time. Irregular cycles if they're women. They're a mess. They feel terrible. And yet, if they were diagnosed by blood with hypothyroidism, then they're taking a synthetic thyroid. And if they still have all those symptoms, that ought to tell them and their doctor that the synthetic thyroid just doesn't work. Something else is going on. When we use a natural desiccated thyroid, which Armour Thyroid does, we compound it now at our center here, desiccated thyroid. And we do that because there have been times that Forest Labs wouldn't be making Armour Thyroid for several months. We have literally thousands and thousands of patients on desiccated thyroid. So years ago, our compounding pharmacy, Hotze Pharmacy, began to compound our own desiccated thyroid hormone without any of the fillers and other chemical additives that they were putting in the Armour Thyroid. And we've had tremendous success using desiccated thyroid all the way back to 92. We had people traveling from all over the greater Houston area and then and then across the state and then across the country because they could not get their doctor to give them a therapeutic trial of thyroid medication. This is what I believe. Anybody who has the signs and symptoms of hypothyroidism deserves a therapeutic trial of thyroid, desiccated thyroid. That's what is key. And you start them on a low dose and you increase that periodically over a several week time, and you can get them up and just follow their blood work as long as it stays within the normal range. For crying out loud, they're doing fine. And they will feel so much better and they will love you. It dramatically grew our practice. Now, I've written a book called Hypothyroidism, Health and Happiness. And it's a chapter out of my first book, Hormones, Health, and Happiness, that I've expanded. And you'll find that very interesting and helpful reading for yourself and also for the patients in your practice. Now, If you want to get a copy of this book, just go to HotzeElite.com. That's HOTZE elite.com. And you can request that book. Also, sign up for our webinar. Now, look, my goal is that if you're teachable and you want to grow your medical practice, and if you want to transition away from insurance to cash-based practice, then let me recommend that you go to HotzeElite.com and go to the webinar and schedule a time to watch the webinar, which I've done. You'll find that very helpful. And then you can fill out an application to join Hotze Elite Physicians. And we'll see if you meet our criteria. And then we'll give you a phone call. So I'm Dr. Steve Hotze. I appreciate you being with us today on Hotze Elite Physicians podcast. And I'm looking forward to having the opportunity to help you be successful in your medical practice so you can have more time, more money, and more freedom to enjoy your life.
If you're ready to do a 180 and take charge of your practice and your life, make sure to visit HotzeElite.com for all the tools and resources you need to transition into a cash-based practice. More time, more money, and more freedom to enjoy your life is waiting for you at HotzeElite.com. This podcast is solely